Hi, friends. Tony DeWitt here, Missouri appellate attorney and a guy who likes to make the law make sense on YouTube. Here's what we're discussing today. I want to talk today about the medic who testified in the Hannah Gutierrez Reed trial. Now, medic is actually probably not an appropriate term. There are different levels of skill in emergency medicine, and the very basic level of skill is EMT, emergency medical technician. It is probably a one semester course, has a lot of practical training in it. It has a lot of things like splinting and that sort of thing, basic bleeding control, but it usually doesn't involve starting IVs. It usually doesn't involve inserting into tracheal tubes, anything like that. In almost every instance where you use the term medic, it's a paramedic, somebody who has the ability to talk to a doctor, get orders, start IVs, and do more advanced procedures, including putting on chest seals and things like that. Before I go too much further, though, I want to make sure I'm pointing out that I am not throwing shade on this young lady. And in fact, I want to tell a little bit of a war story about that because I think it might help people understand what this person was feeling when she was testifying. In the last year that I worked at Blessing Hospital, which is in Quincy, Illinois, there was a gentleman that I had come to know outside the hospital. He was a friend of a friend, and he was from Ukraine. And I called him Mike by a vowel because, like a lot of people from that part of the world, his name was full of consonants, but not so many vowels. And he was a great guy. He'd worked as a linguist in the Army, and as a result, we had lots of things we could talk about military service. And Mike was just generally a really good guy. Now, I knew he had some kind of a serious connective tissue disorder, but like a lot of people who hear about connective tissue disorders, I didn't think that it went much beyond, tendons and that sort of thing. Well, it is a common thing when you are in the hospital to hear code blue emergency department. And that's what I heard on this particular day. I went down there and there was a patient who had come in by ambulance. One of my technicians was bagging him, and I got ready to intubate him, and he shook his head violently. And I said, "Come on, man, you got to be able to breathe." And he shook his head no again. So I took that as a refusal of intubation, and I backed off. And I walked over to the nursing supervisor, who was I guess she was probably about 63, 64 years old, had beautiful white hair. And I said, "He doesn't want to be intubated." She said, "Well, you know who that is, don't you?" And I said, "No." And she said, "It's Mike," and then, by a vowel. And I went over and looked, and I'm like, oh my God, it really is. And I immediately started praying for him, and I knew his wife, and we got his wife who worked there in the hospital to come down, and it was a terrible mess. Well, they took him up to the intensive care unit, and eventually he did fully code. I intubated him. We put him on a ventilator. He was doing as okay as somebody who has that happen can do. And then at some point he just lost all of his blood pressure, and he was not salvageable. He wound up dying. I was asked to be one of the pallbearers at the funeral, and it is very easy when you work in a hospital to sort of tune out people that you don't know when they pass away, because they're not your friends. You don't have any emotional connection to them. You haven't worked side by side with them, for example, forever. And so when somebody that you know passes away and you're a part of that, it can be very traumatizing. And I think what you're seeing here when we look at the testimony is this young lady having to relive the trauma of that day. As a basic EMT, she would not have had the skills to treat this injury. She really needed to be a paramedic. She really needed to have better medical equipment on scene. And she used a non-rebreather mask to provide oxygen, which was a good choice. It's the only one that will give you 100% oxygen, and that was exactly what was indicated. She made good choices in that regard, but basically this was just beyond the level of her skills, and I again think production is liable here because they did not have a medic on set. They didn't have a paramedic on set. They didn't have sufficient resources on set. They were out in the boonies and they didn't have an ambulance there. They didn't, any transport that was going to occur with that coming to the location and then leaving the location. So you're going to build in time coming and going, and that's not a good thing when you have serious injuries. And of course, it's obviously foreseeable that when you're dealing with firearms on a set, you could have serious injuries. And as the young lady said, whenever there is any kind of a production in Hollywood that is a union production, there is always a medic involved. Obviously, that's a basic EMT. And watch here how she describes what her role generally was.
My name is Sherilyn Schaefer.
Ms. Schaefer, how are you currently employed?
I am employed as an EMT in the film industry, a medic.
Can you just explain to the jury the situation, the connection between movie sets and medics? Is a medic always on a movie set, and if so, why?
Usually, if it's a union show, a medic is always on set. For the potential that there could be something dangerous that happens. But 99% of the time, we are in charge of making sure the actors, and not necessarily the actors, but the crew have sunscreen, bug spray, Advil, electrolytes. If it's hot out, we make sure everyone stays hydrated. If it's cold, we hand out hot hands. That's majority of it. If somebody gets a splinter or a cut, we take care of those as well. If somebody gets injured enough that they need to go to get stitches or be seen, we bandage them up, we send them off. And then we are in charge of the paperwork that goes with the production to make sure that the injury can be to go through workers' comp.
Next, she lays out what her training is, and she says she's a licensed EMT. She didn't say paramedic, she said EMT. So we have to assume that she's at the very basic level. Basically somebody who does remove splinters and put Band-Aids on cuts. And this is not somebody you want when you have massive, major trauma with two individuals.
How long have you worked generally in the film industry?
I started in the film industry in 2008. 2009.
Okay. And how long have you worked as a medic in the film industry?
Since 2014.
And can you summarize for the jury what your medical training consisted of that allowed you to be qualified for this position?
I'm a licensed EMT.
All right.
Shortly after revealing that she is an EMT, she was asked about the way this operation, this particular production, contrasted with other productions that she'd worked on in terms of firearms handling.
Was the handling of firearms by the armorer on the set of Rust different than what you were used to?
Yes.
Can you describe to the jury what you noticed, how you thought it was different?
I noticed the armorer on Rust did not secure the weapons as a normal armorer would, or an armorer on productions I've worked on before would. Normally, the weapon would be secured until it was time for the actor or stunt actor to need it. And then the armorer would go to their, generally a locked cabinet, grab the weapon, take it to the actor or stunt actor. With the first AD, sometimes the stunt coordinator, depending on who's there, open the weapon, empty it, if it needs to be emptied, show the actor or stunt actor the type of bullet, I guess you would call it, that's going to be in the gun, show it that it's not real, and then, or essentially check it in front of the actor and the first AD to make sure that everyone's comfortable with it, and then hand it over to that performer for the shot, for whatever shot they are shooting.
And just to be clear, what you just described was what you are accustomed to.
That is correct.
Can you explain to the jury how that procedure worked on the set of Rust?
A lot of times when I would notice our armorer hand the guns over to the actors, sometimes checking them, sometimes not. Generally, once the scene is over, you would remove the weapon. The armorer would remove the weapon from the actor and re-secure it until it is needed again. On Rust, that did not happen a good majority of the time. The actor still remained in possession of the weapon, whether it was in their holster or in their hands.
Now, some of this testimony was undone to a certain extent by showing this witness's general lack of knowledge with respect to firearms and protocols, and the fact that she's not an armorer and she's not in charge of props and she doesn't have that background.
So you are not, did you just say you don't know the difference between a replica gun and a real gun?
If I were not to see them, touch them in front of me, no, I would not.
Are you aware whether a replica gun even requires safety checks?
I'm confused by your words. Do you mean if you mean a rubber gun, that does not need safety checks. You would not check a rubber gun. But if it is a gun that you put ammunition of any kind in, whether it's dummy or, whatever other the quarter loads that they use, then those would need to be checked for safety. But a rubber gun would not.
And you're saying that despite never working as an armor before, right?
That is correct. I am not an armorer.
And you've never even worked in props as a props assistant, have you?
I have not worked in props. That is not my craft.
However, I felt like this particular cross-examination was ham-handed. I don't know whether they gave it to the young lady to do because she has a softer approach or what, because this is a pretty sympathetic witness. And I think the jury connected with her. I mean, I connected with her, so I think the jury probably connected with her too. Now, one of the things that they did when they tried to impeach this witness and cross-examine her was suggest that because she has a civil lawsuit involving this case, that was why she was testifying, essentially trying to feather her own nest. That's a legitimate way to impeach a witness if that's there, but I think this badly backfired. And listen to how the prosecutor, who was very good at this, rehabilitates this witness, and then let's watch at the end here for what happens.
You were asked some questions about a civil lawsuit, and you were asked if you were testifying today because you thought it would help your civil lawsuit.
Correct.
And I think your response was, you didn't do it for money, that's not how it started. So I'd like you to, and then I think you got cut off. I'd like you to go ahead and finish that.
The reason that I brought any kind of lawsuit to anybody in the beginnings is because I wanted change in our industry. I did not want something like this to be able to happen again to anybody else, to their families, to the crew that knows them as family. I wanted some sort of change to happen, some policy change, whether it be required to have a standby ambulance or it be required to have additional medics if there's going to be big stunts or big gunfire or anything that could potentially cause, somebody to become injured. I wanted that change in our industry because on that show there were roughly 75 crew. That is minimal to compared to what I normally would have on set. I would have no less than 300 usually before I would be approved to have an additional medic to come and help me. That is just not okay. That is not okay. That is just not okay. That is not okay. And being the only medic there with 2 patients knowing my resources were not close enough to help in any significant way is what I wanted to change.
And have you suffered from extreme trauma as a result of this?
Yes.
Um,
Can I just expand?
sure.
I'm gonna object.
Okay.
So they drew an objection when she asked if she could expand on her answer, and the judge then allowed her to do that. That resulted in this testimony.
Let's proceed. Upon my questioning, you asked if I asked you about your claim for emotional distress, and you responded and asked if you could expand on that. The court is going to let you. Please expand.
Thank you. I went home that night and I looked at my little boy, who's the same age as Helena's son. And all I could think about is how I could not save his mother's life and how he was going to grow up without a mother. And how her spouse lost the love of his life.
Understood.
I did not expect this testimony. I did not expect this testimony. So you're going to, and I mean no harm to you, but we're going to strike that testimony, okay? So disregard that testimony, okay? All right, let's.
Okay. All right. Thank you, ma'am. I appreciate your time.
All right, thank you. Wait on.
Now, at the end there, you probably noticed that the lawyers all went up to the judge's bench and had a conversation. And of course, they mute it so you don't know for sure what they're talking about, but I have a pretty good guess as to what they're talking about. Right now, the defense is asking for a mistrial, and the reason that it's asking for a mistrial is because that was heard by the jury. And as I've said time and time again, when a judge issues an instruction telling people not to pay any attention to testimony, it's like taking a highlighter and underlining text, or saying, okay, no matter what you do, don't think about elephants in pink tutus dancing on tiptoes. I don't care what you do, you can't stop thinking about that when somebody says something like that. And indeed, when you tell people to ignore what that woman just said, it makes the jury suspicious of why they should ignore that information. And so as a result, what happens is they go up and they ask for a mistrial, and basically they are just securing the record for appeal here. The judge is not going to grant a mistrial in that situation because she spontaneously struck that testimony. It was going to go to a place that was much worse than what we actually got. And I thought it was very nice that she said, look, I'm not saying this is anything bad about you. I think what she said is, I'm not trying to cause harm. But I understood what she was meaning. You know, this isn't you, it's we shouldn't let this testimony in. So the judge is doing a pretty good job there, I think, of keeping control over the trial. At any rate, that's what I have for you today. Thank you so much for watching. If you have the opportunity today, try to go out of your way and do something nice for someone. And then, if you would, meet me back here at the beach again next time. Oh, and by the way, somebody complained about the guy that looked like he was walking into my ear in the background. So I did change the background to try and make it a little bit more soothing and peaceful so that people wouldn't be annoyed by that. I appreciate the criticism and the comments, and if you ever think of anything you can add that might help the channel or make it better, please feel free to let me know. Thank you again for watching. Have a marvelous day, and catch me down here tomorrow. If you liked this video, here are a few others you might try, and don't forget to subscribe. Have a terrific day, guys.